If you've been diagnosed of fatty liver disease, don't worry. The good thing about it is that it is absolutely reversible. In this video, I'm going to be telling you how to reverse fatty liver disease. I'm going to be telling you foods you should eat and foods that worsens it, and I'm also going to tell you at the end of the video how to protect your liver and also the supplements you can take to aid in protecting your liver. My name is Nosmet. I'm a nephrology nurse. Basically, dialysis, kidney, everything about kidney is my specialty. If you had questions in regards to kidney, put them in the comment section. If you want to have a consultation with me, you can click on the link on my bio. It's going to take you to my WhatsApp. I'll also put a link in this video in case you want to have a direct consultation, book a consultation with me. Okay, now if this is your first time, please make sure you subscribe, like, and follow us. Hit on your notification buttons. I don't just think about the kidneys, heart, liver. I teach about women's health, everything about your women's health, women reproductive organs, as well as the men's reproductive organs. Okay, having said about that, let's get to it. Now, to better understand how to deal with fatty liver, how to make your liver go back to normalcy, and how to cure it, very simple. We have to know what causes fatty liver disease. In a nutshell, what causes fatty liver disease is over consumption of sugar, specifically fructose and sucrose. Okay, sucrose being the normal basic sugar, table sugar that you put in your food. So the consumption of both fructose and sucrose, okay, sugar, glucose, it sets up a whole cascade of so many reactions in your liver that leads to not only fatty liver disease, it also leads to other complications like diabetes, type 2 diabetes, heart disease, heart issues, dementia, and some other complications. One thing about fructose is that it doesn't, after consuming food that are high in fructose, okay, that's sugar. When I mentioned this, it doesn't, it abhors, it prevents the hormones called leptin from secreting. Now, leptin is the hormone that is secreted after eating our food. So this leptin, what it does is that it makes you, it brings satiety. What is satiety means? It makes you fuller, right? You get full after eating. So when you take much of fructose, okay, these two combination of sugars, fructose, glucose, whatever you seem to understand, okay, food that are so much in this, it prevents that hormone from being secreted. So you see, because these hormones, this leptin is not produced, because that's the hormones that is produced in your brain, telling your brain that you're okay, that it's okay. But because when you take this fructose sugar, food that are high in fructose, okay, high in sugar, so that you understand what I'm saying, it doesn't, your brain doesn't stimulate to tell you that you're full. So this makes you eat more and more and more, not even knowing that you're full. So over time, continuous consumption of fructose, of sugary food, okay, you should know, I've explained what fructose means. It makes you, it brings about leptin resistance. So you now overeat. You don't even know when you're full. So because of this, it makes you more hungry, and you're not you don't get filled up no matter what you eat. In fact, there is a research in the United States. Okay, they made a research, and if we found out that 7 days of consuming high fructose food that are high in fructose, leads to insulin insensitivity in the liver. High triglycerides. Okay, so. Now, the question is, how do we avoid fructose? Fructose is a compound found in honey, in some food, honey, some fruit and vegetables, okay? Now, I know you will say that this food people have been eating this food, honey, bananas, food that are high in fructose, okay? Now, humans have been eating this food, they have been consuming this food without any problems until it becomes there becomes a chemical degradation. It's no longer occurring natural. Companies are now adding tons and tons of compressed fructose in food, and then higher consumption. So people are now eating it so much. And for the fruits that have this fructose, okay, because I know that's what you will say if I'm saying that, okay, what about the fruits like banana, watermelon that have this fructose? What else? What are you going to do now? Because they are fruits, okay, our system intestine has the ability to convert this some certain amount of fructose, okay, to digest it, to convert it, about 4.5 grams of fructose. That's what our body can, intestine can actually degrade, okay, when we eat. So when you eat fruits and vegetables that has this fructose in them, your organ, your intestine, degraded, which is about what we get from the fruit and vegetable. We don't get more than 4.5 or 5 grams. So your body, degrades it. However, vegetables and these fruits now that has this fructose has a lot of fibers, which will also help degrade this fructose found in this fruit. Do you now understand? Some of these fruits too, not some, many of these fruits will have vitamin C, which also blocks this fructose from the food when it's been ingested and kind of digests them, okay? So I hope you're understanding. So this brings us to one of the group of food that you need to stop eating when you want to reverse fatty liver disease. I hope you did not skip all through and then get to this point, because if you skipped all through, you will not understand all the explanation I've made, and that is sugary drinks. If you've on this page, if you're following me on social media platform, you should have known by now on the dangers of sugary drinks, on the dangers of beverages. Okay, I've explained that a lot, so I think you should locate the videos on drinks or food that are bad for your kidneys, your heart, and your liver here on my social media, on my YouTube, and some other part of my social media. Okay, now beverages, sugary drinks, fizzy drinks like the ones I'm going to put a picture, but I'm avoiding to put a picture. But cola products, all those products, anything that is sweet that you buy from the supermarket that is sweet, that you take after taking your food just to relax, okay? There are also juices, okay, can be any juice, and most of the times they are written that they are healthy, that they don't have I don't know, whatever. And this thing are being promoted on the internet. People are giving it to their kids, people are taking it because they are, assume that they are healthy. In fact, orange juices, cranberry juices, so many juices that they are saying is healthy. What you don't know, that there's so much amount of sugar, refined sugar, that are so much loaded in these drinks. So what you need to do is, when you're buying these drinks, just check at the back, check at the servings, see how many grams of sugar that is in this drink per one serving. Okay, like a cup. Don't even be deceived by these drinks when they say no sugar added, no artificial sugar, or 0 grams of sugar added. It may be natural, as they say, but it's highly concentrated, and there is no fiber. Those fiber that you get from those fruits, when you eat the fruit or vegetables, those fast fiber that you get in them that helps block the fructose, it doesn't have it. So when you drink them, immediately it spikes up, it causes your liver, it spikes up your insulin levels, and your liver is damaged the more. Now, another drink that is also loaded with sugar that you are not aware of. This is for people that are, this is absolutely for everyone. But if you're having liver problems already, if you want to protect yourself from liver damage in the future, please, you should be very aware of these drinks that I'm mentioning. Another drinks that are also loaded with lots of sugar that people are not aware of is energy drinks, sports drinks. It can be in so many forms. All those energy drinks that you want to ask me about right now in the comment section, they are the ones I'm talking about. They have lots of loaded and hidden sugars that can spike up your insulin level, and also cause more damage to your liver. Now, the American Heart Association actually suggests eating less than 20 to 35 grams of sugar in a day. But if you are suffering from fatty liver disease, I recommend that you should abstain totally from every drinks, every food that has high sugar and processed sugar. I would also suggest you stop eating dried fruits like dates, prunes, raisins, all those fruits that are, nuts, dried nuts. Now, they are natural, okay, but they have concentrated amount of sugar in them, right? So when you eat lot of them, okay, and of course, I know you would want to say that they are fruits, okay, but they are concentrated, highly concentrated. And also, because they are little, you tend to eat more. And at the end of the day, you've eaten so much that even the ones that your GI tract could, help squeeze out the 4 to 5 grams I told you, you would have, eaten more than that. So I suggest you avoid these fruits completely if you have fatty liver disease. In fact, there's been so many researches on this. There's a research done in Germany I was reading some time ago, okay? Restricting sugar intake, fructose sugar intake in those that have fatty liver has a lot improved their liver health, like by 50%. So please, if you can, this is one of the best thing you can do for yourself, okay? The next thing you should also know in drinks is alcohol, beer. They have lots of sugars in them, fructose. I hope you know. So as well as you have to also avoid them totally if you have fatty liver disease or if you have any liver issues at all, okay? I made a video. On that video I made about diabetes, right? I think diabetes or high blood pressure. I mentioned the kind of type of amount of alcohol you should take in a day if you must. I measured it, so I think you should watch it if you're interested in knowing the alcohol that is okay for a day for both men, women, and our old parents if you're old. The next thing to do is eat protein. Let protein be your first meal of the day, okay? Breakfast or depending on when you take your first meal of the day. Protein is good because when you eat protein, based on some researches, when you eat protein as the first meal of your day, it helps you feel fuller. It helps control the other food you're going to eat by the end of the day, so you won't have so much hunger to take more sugar or sugary foods, okay? That leptin is produced more because protein has a lot of fiber and it is easily metabolized by your body and it makes you feel fuller. Also, so if you find yourself that you're having satiety for sugary thing, just try to eat more protein, especially for the first day. The first food you have in the day, if it is protein, made with protein, you will feel full, okay? Make sure to eat like 25 to 35 grams of protein in a day. So because of this, it will make you lose weight too, okay? In fact, it has been shown that losing 7% of your body weight can help a lot in reversing your fatty liver disease. So many studies have shown that. So for those that are overweight, this will help you a lot, especially the non-alcohol fatty liver, okay, caused by non-alcohol, which is the most severe kind of fatty liver disease. So as you're also eating this proteinous food, please be aware on the kind of fat that you are eating. You have to eat the good kind of fat, okay? Like you have to take omega-3 fats. You have to omega-3 fat can be seen in fish oil. Take more of fish, okay? Please avoid fried foods, okay? Some kind of oil, groundnut oil, corn oil, right? Some oils, okay? You have to be aware of them so you don't go to fry your food and then because you're eating meat. Also reduce or avoid red meat in this process, okay? So you have to avoid it, and fish is totally better. What's the name of this fish again? Yeah, sardines, okay? Sardines, fish are good. They are packed with omega-3 and fish oil. You can also supplement based on your doctor's prescription. You can meet your doctor and ask, but these are seen to help with fatty liver disease. Okay, eat the good kind of oil. Be so aware of the kind of oil that you're eating. Butter, ice cream, fried foods, chips, all those things that are, no, it's going to make it worse. So you have to completely avoid them and eat the good kind of fat that I mentioned, because those other ones has a omega-6 fatty 6, yeah, omega-6 fatty acid, yeah, but this one you need actually fish oil, omega-3 fatty acids. Okay, so please, you have to be very careful in regards to this. Also, eating, for instance, palm oil, this is good, but very, just a little. Okay, I'm not saying you should not eat your red meat if you want to, but let it be very little, like in moderation. Okay, please, this will affect kind of. Okay, so ice cream, cheese, you just have to stop them or eliminate it a little, like to the nearest minimum if you have fatty liver disease. Okay, so saturated fats, you have to reduce it to the nearest minimum. If you can stop, beautiful, but reduce it to minimal. Okay, now you can now eat polysaturated fat, for instance, gotten in avocado, pear, almond nuts, salmon, fish, sardines, all those ones I've mentioned initially. Oil, what oil are you going to use? Olive oil is beautiful, it's the best than using palm oil, cornflower oil, groundnut oil. Olive oil is the best. Okay, it will even help you heal better. Okay, but don't drink it, don't just go and drink it, okay, because you feel it's going to help you heal. I mean, in cooking, that's the best oil to use. For those that have that are overweight, that have been told to lose weight, that want to do keto diet, this is good, but you just have to be sure on the way where you get your fat. The kind of fatty food you eat is not, as you can see, it's not all fatty food that you should eat, because they will make your liver not work better, and it's not sustainable. Okay, and the good thing about fatty liver is that you don't need to restrict your carbohydrates. You will take your carbohydrates, but you just have to take them in moderate quantity, and there are some certain kinds of carbohydrate that you shouldn't take. Okay, moderate quantity, so that your insulin level does not spike. Okay, and basically that's it. So food that are low in glycemic index, for I have a video I did on diabetes, food for diabetes. I explained the food that are low in glycemic index, so I think you should watch it if you're interested, okay, to know what this food are. But this food are food that doesn't spike up your blood sugar level, so totally eliminate candies, sugar, flour, bread and all. You can just eat once in a while if you want to take bread, but I mean, it's better to take oats or wheat bread, kind of, right? Yeah, so the next thing on the list is alcohol. Like I mentioned in the case of sugar, right? Alcohol is not only sugar, but it's, if you have to avoid alcohol, okay, when you want to deal with fatty liver disease. The next thing is inculcating exercise in your daily routine, okay, at least 4 times in a week. Please, this will help. Mild, moderate to high intensity exercise, depending on, it's a gradual process. You can start with mild, moderate, and any level you can tolerate. Okay, this will really go a long way in dealing with fatty liver disease and reversing it back. Also, make sure that during the exercise you lift weight, muscle training, strength training, lift small weight. Okay, it will help in restoring your liver back. Okay, so if you do all these things that I mentioned, in a matter of weeks, you will be able to see changes in your test results. When you go back, biomarkers of your liver, you'll be able to see results. Okay, based on the studies that I've study. On some studies I saw and I studied them, okay, people, these things I mentioned really worked, okay, in their liver regrowth. It will help you, it will restore your liver back to normal. Try to do this before your liver turns into a more serious liver damage, like NASH or steatotic hepatitis. Okay, please make sure you try to reverse this. it can even lead to liver cirrhosis or fibrosis, which at the end of the day, when it leads to all these stages, liver transplant is the only If you also want to enhance your progress, you can add supplements, but please, it's not compulsory that you have to take supplements for your fatty liver disease. Okay, no, it's not compulsory that without supplement your liver can't go back. Only these things I've said it works so well, so you eat the right things. Okay, but there are some supplements that will help, okay, with your liver, okay, in seeing to it that they seeing to it that they heal faster, which number one is vitamin E, 800 international units per day. Before you take any supplements or any drugs in the internet, make sure you meet your healthcare provider to tell them and ask them about these supplements, if this supplement is good for you based on your health conditions, because you may be having some health conditions that I'm not aware of. So before you take any supplement or any drugs or anything at all, make sure that your doctor is aware of the supplement you're taking and has to give you a go-ahead order to consume them. So vitamin E, 800 international units a day is seen to actually work with, in a study, is actually seen to work so well in restoring non-alcoholic hepatitis, right? So this is very good for you. Please make sure your doctor is aware of this, because high intake of vitamin E can lead to prostate cancer. High intake, I mean 400 IU. What I said you should take was 80, right? So like high, okay? And so the next supplement on the list is omega-3 fatty acid, or that fish oil. Okay, make sure to get the one that have each EPA and DHA. Okay, please make sure to get the one that has this. Okay, so omega-3, the research on it shows that, based on recent research study, it shows that there's an improvement in AST and ALT. These are liver enzymes. Okay, so I think it's really good. Make sure you consult with your doctor. The next supplement on the list is choline. Choline as a treatment for fatty liver. There's a recent research, okay, it shows that people that consumed, I'll tell you the food that are high in choline. Don't worry. People that consumed food that are high in choline has a good increase in their liver enzymes. Okay, it helped resolve the non-alcoholic fatty caused by fatty liver, non-alcoholic fatty liver disease by 81%. So you can see that's a very high one. But however, we still need more research to prove that eating food high in choline or taking choline supplements can actually work in this. But however, for now, I think there is chance, so you should actually start eating food that are high in choline. These are food that you see. Okay, don't worry. So these food are eggs. The eggs has to have egg yolks in them. Lean meats. Okay, like lean meat. You know what lean meat is? Chicken breasts, legumes, potatoes. Okay, legumes like beans. I don't know the kind of legumes you have in your plates. Okay, millet and all. Okay, so these food are high in choline for now, since the research is not yet we don't know the dosage. Okay, but it's just that there's a research, so I don't know the dosage you should take. So I don't say you should go get the supplement. So I think you should I'm suggesting you just take food that are high in choline, which are these food that I mentioned, not just to basically go and get the supplements. Okay, so also getting enough seafood. Okay, it is also very beneficial in resolving fatty liver disease and also your general health. Okay, please make sure on the amounts that you're taking, you don't take all these things at once, portion by portion. Okay, also this choline can also be found in sunflower seeds, yogurts, Greek yogurt, cauliflower, cabbage. These are very good for your liver and your kidneys and your general overall health. And these things has low glycemic index. They are very good for you, especially in reducing diabetes, dealing with. Just look at that video on food for diabetes. I explain how to make this food for yourself, and so that it will not be boring. Okay, so there are so many other supplements which I may make as time goes on, but I don't want this video to be overly long. Okay, remember, if you want to have a direct consultation with me, click on the link on my bio. I think I will be putting a link on this comment section. Okay, next video we're talking about hepatitis and how to deal with hepatitis. Though there's a video on hepatitis, I think you should go watch it. It will really help you along. Watch it, hepatitis. Okay, watch it. And I'm also going to put a link about the hepatitis video. I'll also do a video on food, because I didn't really explain to you the food and probably the supplements or how to cure hepatitis, but that video has a lot on the treatment of hepatitis. Okay, so let me know if you have more questions in the comment section. Have a nice day.